Good afternoon or good morning to you folks, and welcome to today's 60-minute webinar, Beyond BMI, deep dive into counseling and conversating with patients on weight management. My name is Elizabeth Breidenbach. I'm meeting and event specialist based in our events team here at NAC, and we are pleased to bring you this event along with our 4 fantastic panels that you see on the front of your screen. Just a few friendly housekeeping reminders for you. Number 1, this event is being recorded and will be available for playback at a later date, typically within 5 to 10 business days. With that being said, you'll receive an email from us, NAC, with a copy of this recording. You'll also get a copy of today's slides, though I will just preface with the slides today that it's a very minimal slide deck because we have a fantastic fireside chat conversation for you. So in a second, I'm going to be actually taking these slides down where you're going to be able to hear from our fantastic panelists. Chat is disabled, but Q&A is open, and Q&A will be open for the duration of this event. We've got your live or your pre-submitted questions that you had when you registered. Thank you for that. But again, throughout today's session, if you'd like to submit a question, open that Q&A box. You'll be able to type anything in there. We will preface also that if you would like to submit an anonymous question, so again, it will not tie your first and last name. There's going to be a little checkbox at the bottom that you want to click. That lets us know that you would like to remain anonymous for your question. Any questions that we cannot answer in the time allotted, we will make an attempt after the event is completed. So again, we can only answer questions that we cannot get to live if you are a known participant. So again, you did not click that anonymous button. So anonymous will truly be anonymous. With that being said, I'm going to go ahead and turn things over to Sarah Price, one of our fantastic colleagues here at NAC and our moderator for today. Sarah, the floor is yours.
Awesome. Thank you so much, Liz. That was such a nice welcome. I feel very warm. Thank you so much. So glad to see there's about 163 of you on this webinar, which is wonderful. We're really excited to have a great conversation this afternoon on this topic. And I'll be your moderator today. I am a community health nurse of 22 years. I'm currently the Director of Public Health Integration at the National Association of Community Health Centers, and have been working in the pediatric and family weight management space for about 3 years. With me today, we have 3 amazing panelists. They'll be introducing themselves, but I just want to let you all know that we know that today's topic can be really sensitive, and there's lots of facets to it. And so what we put together for you today is just a panel of folks who have worked in the space in different areas and arenas, and can really, talk to the subject. But we'll also be very honest that we may not have all the best answers or all the best practices in there, but we still talk about it. So I want to turn first. So as they introduce themselves, they'll kind of say who they are, where they're from, and then also kind of what brings them to this space. What's kind of some of the experience they've had and where they work in this space as well. So I'm going to start with Jessica Wallace, a PA from Denver Health. So if you want to introduce yourself first.
Awesome. Hey guys, so happy to see y'all here. As Sarah mentioned, I am a family medicine PA. I've worked in FQHCs for 17 years now. I'm also the director of our Healthy World programs at Denver Health, which includes things like an intensive behavioral intervention family healthy weight program. We also have multidisciplinary clinics to support patients across the lifespan. And I think what I bring to this table is been in this space for a while, and I have even in the last couple of years been learning a lot about how maybe we haven't always gotten it right, and so we're having a lot of these conversations within our teams and within our FQHC network, and it's angsty and it's uncomfortable and extra important. So I'm happy to be here.
Thanks, Jessica. Next, I'm going to go over to Gloria Montijo from El Rio Health Center. Gloria, can you introduce yourself?
Good morning, everyone. Well, it's good morning here in Tucson, Arizona. My name is Gloria Montijo. I'm the Health and Wellness Employee Patient Health Improvement Supervisor here at El Rio Health Centers in Tucson, Arizona. I am responsible for coordinating and staffing movement classes and wellness classes for over 150 patients and 1,300 employees. But I have over 13 years of experience working with wellness programming for adolescents and children. My background is in education and behavioral health. And so thank you so much for having me today.
Thank you, Gloria. And last but absolutely never least is Jeannie Lindros with the AAP. Tell us about yourself.
Hello. Hello, everyone. And it's good afternoon for me, but good morning to the others. But I'm the director at the Institute for Healthy Childhood Weight at the American Academy of Pediatrics. So I work on the policy side and the clinical guidance side. And I have the pleasure of working with Sarah and Jessica on a number of activities related to family healthy weight programs. So I'm coming in here with the perspective from the evidence base and my experience working and supporting for over 20 years, pediatricians and pediatric clinical providers who are trying to do obesity prevention and treatment within the clinical setting.
Awesome. So a well-rounded bunch. We're really excited to explore about 4 different areas when it comes to this topic, with really the goal in mind of enabling those of you who are listening to become a little bit more educated about weight bias and stigma, and but also have some tools to have those conversations. The focus of our, or the kind of the population focus today is in the pediatric space, but as we know, no pediatric conversation ever happens without a family conversation. So that's kind of the lens that we'll be focusing on today. So I'm gonna kind of throw our first question to our panelists. Segment 1 is truly about engaging in open patient conversations and family conversations. So the first question I'll pose to the group is, what are the most effective techniques for starting conversations about weight with patients? And you can kind of tag onto that. The second piece is, how can healthcare providers have supportive and non-judgmental conversations? So what are the tips to kind of start the conversation and then to keep it non-judgmental as well? So I think, Jessica, I will start with you. Not to put you on the spot, but I am.
We're just jumping right in here to the big stuff.
Just jumping right in, absolutely.
You know, I think obviously this is there is no one correct response here. I think we've learned a lot. I will say over the course of my career, you know, it's really evolved from, you know, starting a well-child check with looking at a growth chart and kind of seeing what the trajectory is, and, you know, is it bad or is it good? And you know, and then kind of tailoring counseling and education around what we see. We've learned a lot that, you know, that can be stigmatizing, that there are very real harms with weight stigma and bias, especially those that are perpetuated within healthcare. And so changing language around focusing not just on particular numbers on a scale, but on emphasis on health, around not using weight as the, you know, decision point to say, am I going to ask about diet and nutrition and physical activity? Am I going to, you know, provide counseling support or referrals? And really just opening up the lens of, you know, having these conversations about health with everyone, and then looking at health as the ultimate marker for success.
Awesome. Gloria, coming to you, Gloria. Anything to add or anything different from your experience?
No, so by the time that I get a child or an adolescent in my program, they've already seen their provider. And oftentimes that's when I get them because they haven't had a very good experience. And by that, I don't mean the quality of care, but the experience around weight. The parents then come to me. I've made my child obese. What can I do to make him unobese? And so those are things that we need to keep in mind, and especially when we're referring them into programs, that we don't call these programs weight management or diet programs. That maybe, you know, we encourage wellness, family wellness, you know, and getting to know the family as a whole, I think is very important as well. And I know that providers only have a certain amount of minutes with them, and so that's really difficult. But the beauty of it is that when I work with the providers, I get to know them, and then I'm like, okay, this is what they meant. You know, they only had 5 minutes, so I get to do some little intervention there as well.
Great. And Jeannie, changing the question just slightly, again, you work, you know, kind of in the provider education space and clinical guidelines. Anything to add from kind of that lens? Are there, you know, specific approaches that you've seen or been able to, lead providers in adopting to just get that conversation started?
Sure. So I think just to recognize exactly what Jessica and Gloria said, like this is highly individualized and needs to be tailored to each family. And I think with all of our pediatric care, we're centering the child and family, right? So we can't take the child and family out of that context. So in the clinical practice guideline that was released a year ago, that's, that whole child approach is incredibly that needs to be the focus. So it's not just one data point that we're talking about, but we're talking about the whole child in the context of where they live, love, play, and grow. And the goal of all of pediatric providers is really fundamentally the same as parents, right? It's to optimize healthy growth and nutrition and development for their children or their patient. And so recognizing you're all coming from that foundational same space is really important, and building upon that, right? So in terms of the evidence, we have to remember that BMI percentile, because in kids, that's what we're really talking about. BMI percentile is just one data point in that whole picture of the child, and really understanding the context of both the culture and community and family with which they live. And then, recognizing and talking to them and asking permission is really important. One of the key things in terms of the evidence base is asking permission. If we're going back to your question about, specifically just talking about weight, what you really should be doing is contextualizing all of the markers that you're looking at, the physical findings that you might have. It's the same way you communicate. If you find something under review of systems that's troubling, right? You have to contextualize that and present it in a way that recognizes that family and centers that family. But ask permission is really important. May I talk about your weight, or are you comfortable talking about your BMI percentile right now? And if not, can we make a time to talk about it later? Really using language that's person first language. This is, the evidence is very clear. And this really becomes, to Jessica's point earlier, actually, that was another conversation we had another day, but I remember it so well. It's this notion of like, how things are documented in your medical record really matters, right? So having person first language and non-judgmental language, because patients often see these, whether it's in a printout at the end or in their patient record. And last but not least, really recognizing and using neutral language, which you can ask the family, listen to the family what they prefer in terms of language. In terms of research, there is no one magic word that works, but things that are more neutral are things like, I have concerns about unhealthy weight is one that tests better. One that folks seem to also understand is like, I have concerns that your weight may be more than for your age or height, and I would just want to talk about it. Or I have concerns about your growth trajectory or your growth trend. And recognizing that how we use the growth chart, to Jessica's earlier point, it's a personalized map of your growth and progress. And every parent wants their child to progress on the growth, just growth in general, right? And development, like you can't wait till they get to the next developmental phase. And the growth chart's a tool to help monitor that. And it's personalized. And so thinking about it from that context, you can use all of these tools in having tailored conversations about what you may see on an indicator in a growth chart, and or on a review of systems, and or on the physical exam, maybe a constellation of things that are elevating a point that you want to discuss. One that you want to discuss jointly with them and collaborate on, and give them the information so you collectively can have shared decision making moving forward around what you want to do next.
Perfect. Thank you. So that's a perfect segue to our next segment. Jeannie, thank you so much. Before we move on to kind of the next questions, Jessica or Gloria, anything else to add? That's something you didn't say or wanted to share, or we'll keep it moving. Thank you, Jeannie, for sharing that.
I don't know if, sorry, I'm remembering and I didn't say. Well, let me see what your next question is. Because you also asked about training, I think, and I just wanted to pull that in if there was something.
I did, and actually, that's going to be our third question. Okay. I'll come back to you, so don't forget it. Perfect. So segment 2 gets a little bit deeper. I'd love actually Jeannie and Jessica and Gloria as well. Kind of sharing of how to start that conversation. And there's no best way, but there's some good ways. So let's layer on a little bit of higher difficulty. How does trauma and trauma sensitive care And also social drivers of health. How does this relate when you're talking about BMI and weight assessment? And how have you seen, or what are some, kind of best practices that you've seen health centers kind of integrate trauma sensitive care, and kind of addressing social drivers of health in the same way when you're having these conversations? Gloria, I'm going to start with you this time.
Always have issues unmuting. Well, to kind of, I don't want to say go deep into this question because I am not behavioral health. I do have a behavioral health background, but it's understanding what trauma is, and it's defined as exposure to an extraordinary experience or an event that causes harm inside and the body remembers. Trauma-sensitive care is being aware of the individuals that we're working with, that they are coming from a background that may be quite difficult, and we don't know what their full story is. We don't know what their family dynamic, what their systems looks like. And so being aware of the family or the individual as a whole is so important, and looking at them from that level, as opposed to here's an individual with a BMI that's above 27, therefore he's categorized as level 1 or overweight. And so what is going on? I think Jeannie hit the nail on the head. What is going on? Looking at it from, there's so much more. Are they sleeping? Are they eating? Are they on maybe government assistance, or maybe their government assistance didn't come? Does the parent, which oftentimes we do, I think I went on my first diet when I was 11. I'm 5'9". I've always been a plus size woman. And I thought I was fat because my pediatrician told me I was fat when I was 11. And so I did my first National Geographic, now I'm dating myself, diet when I was, 11 years old, because I thought I was overweight. But they never asked how I was sleeping, what I was eating. Both of my parents were illegal, so we feared deportation. And so nobody ever asked how we were doing as a family, or if we had a place to live. And I think it's important to keep in mind that we are dealing with humans. We're dealing with people that are experiencing different life events that can affect weight. Are they medicating with food? And all of a sudden we see this growth increase, right? And maybe you saw them 6 months ago. Are they living with a significant other, with a family member? Did parents get deported? And so those are all things that you have to keep in mind. One of the things that I see a lot is with my staff is we have our own trauma too, right? And so sometimes even dabbling into our patients or our participants' trauma, that can certainly trigger us. And so we have to be very careful where training comes in, right? That's where training comes in, so that we can be aware, we can protect ourselves, and we can definitely deal with our own issues that may arise through that. But looking at the family and the individual as a whole, as the complete picture. And I know for some of you providers out there, that is very difficult, but it can be done just by listening. Just take a moment and listen and give options. What does it feel like? How are you feeling? How does that make you feel? I think that's just so important. And that's the practice that I teach my staff to do.
Beautiful. Thank you, Gloria. Thank you for sharing your personal story too. Very impactful. Jessica, what about your experiences with this?
Yeah, I echo so much of what Gloria just said. I think that we all bring ourselves into our work, right? And so, acknowledging where that occurs and how that might interface and interplay, I think is crucial. And I'm not an expert in this space, but I also feel like, when you work in an FQHC, we see this every day, right? And so how do I interpret things like social drivers of health or trauma sensitive care? This is like, in my mind, those help you show up with compassion, right? Because there are so many factors at play that are outside of that kind of outdated version of like, oh, this is an individual choice or failing, right? And so having that extra level of understanding that breeds compassion. And then also that pragmatic piece of like, if I'm going to provide support and guidance, I want it to be relevant. I want it to relate to what people can actually do and where they actually are in that moment. And it might be that, focusing on the improving nutrition just can't be a priority for the family in that moment, right? Because there's other things that, take precedent, or, and giving space and, utilizing that long-term longitudinal relationship that we have with patients to say, okay, if now isn't the time, we're here for later. And again, just using that lens to have a deeper understanding and working with people over time.
Excellent. So Jeannie, during your introduction, you talked about the many, many, many years of experience you worked on family healthy weight programs, and obviously with my work with you doing that too. Is there room for both being trauma sensitive and including social drivers of health in family healthy weight programs? Like how do those kind of correlate? Particularly, and maybe if you can describe what a family healthy weight program is real quick too.
Well, and I'll take a step back and just say, like, going back again to what Gloria and Jessica said and I said earlier, the evaluation of a child should be centered across that holistic approach, right? And all of that informs where you need to go and what you need, the choice. And essentially what you want to do is empower the family with information and offer choices, right? And it's up to the family to choose the path they want. And you want to do it in a way that's sensitive. And particularly with pediatric obesity, we need to be thinking of the structural aspects of it, right? And recognizing that there's biological, there's social, and there's systematic factors that influence one's ability to be healthy. And those structural drivers and those social determinants of health, understanding that and using that and training your staff in that, as it's similar to this notion of trauma sensitive care, recognizing that there's context and this isn't an individual condition. And like the more we can train, there's a lot of weight bias and weight stigma training, and we'll have some resources at the end, but recognizing that multifactorial aspect of the disease is incredibly important in terms of just sort of being able to house it, and also then looking at the whole child, right? Because it's not, to Jessica's point, it's not just a nutrition issue. There's many things that are going into this, and you need to be able to recognize those and really change it from there's not something wrong with a child, that what is happening here in our environment, what is happening in their life right now that you can help them with, that helps optimize their health. And doing that detective work and understanding all of that is really important. Empowering them and being a partner, building that relationship with them, and trust, where you can offer options. And an option might be, if they are interested and engaged, a family healthy weight program, to your point, Sarah. And family healthy weight programs are an evidence-based treatment that helps both families and children and adolescents build resiliency. I think of it as it's a different form of resiliency, but we basically have toxic environments in some cases for many families in terms of being able to lead healthy lives. And family healthy weight programs empower families with some skills and knowledge to help counter some of that in terms of intensive health behavioral lifestyle treatment. And the evidence continues. The U.S. Preventive Task Force recommendation just reinforced this the other, I don't know, I guess it was 2 weeks ago. At this point, time is sort of escaping me. But the fact there's tremendous evidence that these programs work, and the outcomes are well beyond. These are not, I think it was Gloria who said that earlier, these are not weight reduction programs. These are family healthy weight programs that work on building capacity and skills and the outcomes are around, improved mental health, less disordered eating, like lots of different things outside of, it may just be weight maintenance that is the outcome, but there's building self-efficacy, both for the family and the child, which are incredibly important, and building skills to navigate a world which unfortunately does not prioritize child health. And so empowering them to be able to do that is what family healthy weight programs do. And these different providers here have done an excellent job in partnering and doing that in community health centers.
Another perfect segue, Jeannie. Thank you. Our next segment kind of then gets to, what are some successes that we've seen? We've heard of a lot of the challenges, that especially healthcare providers have in providing trauma-sensitive care. But Gloria and Jessica, I'll start with Jessica. What's an example of a successful intervention? Maybe that, that you had yourself, or you've seen, a team that really addressed trauma and SDOH in their care to, in this space. Any specific examples or anything specific come to mind?
I think I would start by saying, I think within Denver Health, I'm really proud of kind of the umbrella of programs that we have to really each, do different things and provide a menu of resources that families can kind of pick and choose from. I think in my mind, anything is a win if it feels positive, if it feels fun, if it feels encouraging and supportive. And so if that is what happens in a well child check, because we've been having ongoing kind of discussions and providing tips and tools for busy primary care providers to be able to feel like they can navigate those conversations successfully, to where do we, hook patients in with some of our other more intensive programs and build community and interact at the family and community level. I think that, the advantage you have as a child is that your job is to grow. And, you are part of a family unit where change can happen, not just as one person, but collectively. And again, kids are such incredible teachers to us in terms of their ability to play and have fun and laugh and engage. And so looking for ways at which that becomes kind of the hook and the marker of success as well. So I love seeing our families playing and having fun and feeling supported.
Yeah, I love that. Thanks, Jessica. What about you, Gloria?
I think that starting the program, since I've been involved with Del Rio's programming from day one to our current program, is giving the families the power back. Is they come in with so much guilt. I've been feeding my child ramen because that's all I could afford, and letting them know that it's okay, but let's make that ramen a little healthier. How can you make it healthier? What does health look like to you? And when you give families that power back, that their health is essentially in their hand, and what does that look like to them, not from a clinic point, right? But what does health look like to you? And when they come back and they report, we're eating dinners together, we're sleeping, we're moving, we're walking around the neighborhood, they create these amazing friendships within the groups. I mean, those are all the gains and the wins that I absolutely love. When they no longer feel guilty about their cultural foods, when they're incorporating tortillas in their daily breakfast, or they learn how to make their own because they want to make corn as opposed to the packaged stuff, right? I mean, those are all the things that are just big wins for me. And while, yes, we have data collectors and we want to see those numbers, I had to do that for Jessica because she takes, she's in charge of all that beautiful number and reporting, and, that makes, our big wigs happy. But at the end of the day, those are the measures that just fill your heart, and you're like, they're getting it. They're sleeping better. They're, it's okay to take time for themselves. When we do the parent piece and we tell parents, this is your time, we can talk about fiber, or we can just have coffee and, just talk about how hard being a mom to an adolescent is, whatever it is, you're giving them so much more, and I really love to look at wellness as the whole umbrella. We stress that, but we can't stress that enough, that it does work when we look at each individual family and we have them identify what is important to you. What does health mean like to you? What do you want to work on as a family? I always tell my families, you're the doctor in your family. You live with your family. You have the doctorate degree. You come and see our provider 10, 15 minutes, but really, what works in your family. If you want to get rid of the white stuff in your family, then get rid of the white stuff, all the white processed foods that they're often told that are so bad for them. If that's going to work, it doesn't work for me, but it might work for you, and they come back and they're like, well, okay, so what does work? Let's look at it. Let's dig a little deeper. And when you, again, like I said, when you get those connections, when you get people reporting, we're cooking together, we're eating together, we're sleeping better, we're exercising, we're moving, those are the components of lifestyle medicine right there. And we're able to impact that. We're able to impact. Sorry about that. My mouse just flew.
Beautiful. Beautiful. Jeannie, what would you like to add?
Sure. So I think, amazing stories, and like I love the most motivating stories are like the patient and family success stories. But I sort of came into this thinking, well, I'm going to add something different, which is the stories of teamwork at practice levels, because I think, to me, that's one of the best practices that can happen in terms of having somebody amazing like Gloria and Jessica training other people in their team and building some protocols and building some systems in place to help ensure safety and empathy and compassion throughout the chain of that particular community health center. And when you find things that are successful, having them work. So, or having them spread, and building some type of sustainability into them. So we've used, at the Academy, we've had a number of quality improvement practice initiatives where we've really focused on exactly this. A lot of the integrating SDOH screening, making sure that that's done appropriately, and monitoring, doing the whole child approach, the evaluation for, pediatric obesity is outlined in the clinical practice guideline. And again, it includes the social and structural drivers. And there are a number of resources on the Academy website which have key measures and a key driver diagram. If you want to run your own QI, we have training. One of the other huge things is like, is your staff trained on weight bias and stigma? Is your staff trained on motivational interviewing? These are all the evidence-based in terms of your question around best practices. If we can build that capacity within a multidisciplinary team that's interacting with families, that is, that's long lasting too. And then it goes to each family, and each family will have a different story of success because we need to tailor and individualize that. But if we're all coming in with this foundational knowledge around stigma, bias, motivational interviewing, and trauma sensitive care, then you can, you feel confident that it's across the board. So those are some best practices. And I know there'll be resources at the end to share on like, how do you build that capacity? How do you assess your capacity as a team? And how do you, I think the other important piece, which these Jessica and Gloria are amazing at, but we've built capacity with some of our pediatric practices. Some cases they're in health centers, and some cases they're in private practice, but how do they connect better to the community? And that is another part that you can build systems in place. So when you have a family in need of some type of intervention or to address a food insecurity problem, do you have a path for them? Is that path built into your system? Is that path built into your system to get them into a family healthy weight program if one is available in your area? Like, how do you do all of those handoffs? And how, it's one thing to assess and to do this whole child approach, but you may find a problem or a child that is in need of something, and do you have a system and a practice in place to get them to where you think they can get the most help? I think that those are some of the, operational best practices that are important to set up. They're not always as engaging or fun in terms of, really positive stories, but they are important in terms of like streamlining and really systemizing an approach that is, child-centric and empathetic.
Thanks for sharing that. Jessica or Gloria, anything else to add before we move to our last segment?
I just want to say that piggybacking on Jeannie is, if healthy weight programs aren't for the family, that is a chance to hook them with nutrition services or with other, we have behavioral health services here at Rio. And so if they don't want to continue with the program, that's an excellent way to pull in other staff and get them involved. So we've done a really nice warm handoffs several families.
Great. Our last segment, and then we'll get to questions. Y'all have put some great questions in the chat. We're really excited to answer for you. But Liz, if you can just pull up the slide. Part of us working together is sometimes we use frameworks for things, right? We don't just make this up. There's actual frameworks. So Liz is gonna just flash up the screen real quick on HRSA's Advancing Health Center Excellence framework. And what I want to do is ask our panelists, perfect. How does this framework below, you can kind of see it there, apply and relate to the discussion and general principles to take with us going forward. And you'll see the framework is pretty broad. We're not going to spend all the time this afternoon going over each of those, but we highlighted specific areas within that framework that we felt were pertinent. So Jeannie, because I've been ending with you, I'll start with you on this one. Bingo, I know. This is like the least fun one, but anyways, when you look at this framework and, you know, the areas that are highlighted, how does the framework, you know, apply and relate to what we're talking about today?
Well, you know, it's funny because I think I did do a nice segue into this and I didn't even really mean to do it. But I think, you know, what we're saying is you have to look at, it's multifactorial, not just the disease, but the patient experience and how your team is structured, right? So we were just talking about some workforce issues, right? So do you have a team that is trained and is ready? And are you examining and reflecting on the patient experience, right? That's another part of our work that we do, is like assessing, are we doing an okay job with this, and asking patient and families, and do you have active engagement in terms of patient advisory committees and things like that? Those are all critical, right? And then I think the other piece we want to just elevate here is the social determinants of health are layered through all of this in terms of a health equity perspective. And so that's why they're, you know, it's central to when you're doing an evaluation at the point of care and examining the whole child. You know, part of that is BMI percentile, but a lot of it is also all those other social and contextual aspects of where they are living and how they are experiencing life. And that informs how you approach that child. So this is just a really nice way to look at this in terms of like a foundational springboard, right? To be thinking about how this is complex work, right? And then this notion of quality patient care and safety. I think that's, you know, I talked about how systems work is important within your own clinic, and reflecting on what do you have in place? How are you doing this as a team? Actually being structured about it, having concerted effort, whether it's a formal quality improvement or whether it's like structured evaluations and reflections that you're doing to make sure. And you can think of patient safety in the context of like safe and meaningful conversations, right, around this, and safe and meaningful continuity of care around those warm handoffs that Gloria was talking about. Have you built in all of those important systems so that these things can happen, and they can happen in a non-judgmental, non-stigmatizing, and effective and efficient way? Because the other thing you don't want to do is like give them a number that's a dead end, right? Like that's not helpful. So how do we test that and work? And how do you best use your multidisciplinary team? Because each person on your team is going to have different skill sets. And like how do you build scopes of work and roles for each one of you so that you can really capitalize on those?
Perfect. Jessica or Gloria, who wants to go next? I'll let you choose. Anything to add to what Jeannie said based on this framework?
Gloria give a
Jessica?
little shake. I'll take it next. You know, I think this framework is helpful just for reinforcing all the ways that health centers are awesome, right? You know, and I do think that there is absolutely a role for community partnerships. You know, we don't always have to do all of this work ourselves, but my personal bias, having, you know, implemented these programs that, you know, often have existed in community settings and bringing them kind of in-house, is that, you know, we have a lot of strengths in terms of the longitudinal relationships, in terms of the trust, in terms of, you know, kind of the being able to deal with both the individual and the kind of population community level. As just one other anecdote to share, I think under the category of workforce, like our experience with implementing these types of programs is that it's a tremendous staff satisfier as well. And I say that as a PA who's been involved in this work, but I can also, you know, speak to the folks on my team, right? Sometimes we are utilizing our behavioral health staff, and we're, you know, to the extent to which we've been able to bring on registered dietitians and stuff like that, but it doesn't all have to exist kind of at that top level of training, right? We've created a lot of pathways to get, you know, medical assistants and clerks and navigators and, you know, even volunteers or interns, or if you have community health workers, you know, to really involve lots of levels of our workforce in this effort, which just increases buy-in, kind of legitimizes and solidifies the role of these types of programs and resources into the everyday work of the health centers, and makes people happier. And, you know, it's positive, it's proactive, it's fun, it's a different way to get to know families, and really has kind of, in our experience, strengthened people's engagement and retention. So just one additional anecdote.
Great. Anything to add, Gloria? If not, that's okay as well.
Nothing. They did an amazing job.
I thought so
But
too.
this is a beautiful framework. You know, you don't have to master everything on this framework. You know, work little pieces at a time, and it's continuous work is all what I would have to add to that. So.
Perfect. We're going to show one last slide, and then we're going to get to your questions, because I think it'll kind of seal the deal on this conversation. So we did provide, our panelists provided some resources for you. These will be in the link with the recording, which will be on the slides. But you know, there's everything from the obesity evaluation and treatment guidelines there, to, you know, other resources about the role of pediatrician, early relational health. Most of those are from AAP. The clinical excellence framework that we just showed, and then some other resources, especially, you know, related to trauma-informed approaches, and also weight bias and stigma, and those as well. So just wanted to point those out before. But why don't we go? Yeah, we're about 15 minutes away. Why don't we go to some of our questions? There's actually a lot on family healthy weight partnerships. I didn't realize I was opening such a box when I named it by name, but we'll get to those in a second. But I think our first question that was, you know, is looking at you know, obesity as a medical condition rather than you know, calling it obesity overweight. You know, what's kind of the sense out there is, you know, is it better to look at obesity kind of like a medical condition? They gave an example of patients respond to heart disease or diabetes better than dealing with overweight or obesity. And is that, yeah, what's kind of an approach to that, Jeannie?
Yeah, so I'm happy to start with this. And I think I'll start with, there isn't consensus on this, but this notion of really understanding, I mean, we can talk about the physiological markers and aspects of obesity as a disease, but whether that resonates with families depends on the family, and you're really going to have to work with them. But understanding it as what I have heard numerous patients say that it was freeing for them, that they felt as though understanding that it was a disease and a physiological condition, and it wasn't their fault. It was biological, you know, genetic, structural, you know, all these different things that impacted it, impact how their body responds and grows, was very, very empowering to them. And to know that there was somebody who wanted a partner, and that there are treatment options that can help address some of the biomarkers and concerns. That can be very empowering to some. Others, it is not empowering. So it's really hard to know. There are people who felt, there are some advocates who say that using obesity as a disease makes them feel like they are a diseased body. And that's not what we want, right? So you really need to talk about it as a holistically, but when the structural drivers are understood, you know, like, and you contextualize it, and you talk about, you know, when children have diabetes, living with diabetes, children living with asthma, children living with autism, these are things that they are living with. They are not, and we need to take away the stigma and the blame. And there are evidence-based opportunities for them to improve certain aspects of all of those conditions, right? And having the information is important, and giving people the autonomy of choice and giving them a voice in how they want to have that conversation is really important. So there is no magic answer to that, but we do know that understanding the structural and complexity of it, and removing individual, any notion of individual blame is incredibly, that is important. And that seems to be universal in terms of evidence, at least.
Thanks. Jessica or Gloria, anything to add to that?
Oh, I have so many thoughts and feelings about this one. and an acknowledgement that, again, I feel like I have not always gotten this right. I agree with all of the context that Jeannie provides, right? That it really is individualized. I will say over the course of how I've approached this is I was at one point very much like, let's, add obesity to the problem list and let's help recognize it as this chronic condition and all that comes with that. We've moved away collectively from a lot of that, I think. And most of it is, again, recognizing the potential for harm, but also recognizing that, obesity is not a one-to-one correlate with disease, right? And so how do we acknowledge, again, the real components that might be harder to measure and harder to visualize, right? Part of why BMI persists is because it's a number that you can just step on a scale, even labs and stuff, you got to convince the kid and the family to get their blood drawn. And so, we have done a lot with kind of standardizing to make sure that the kids who are due for screening, get the recommended screening. Certainly when you find signs of metabolic disease or cardiovascular risk or things like that, that is one way to kind of focus in on the health piece and that particular risk. But also, really trying to, I think, make all of the counseling and the resources and stuff not so dependent on having a weight cutoff that makes them eligible for that. And it's still very much a work in progress. But yeah, we've really moved away from as much as possible. And that also means sometimes getting medical people out of the way, right? The programs that we're building now are not even medically run, even though they're operating in obviously a primary care and healthcare space. And that's been really exciting, I think, from my perspective, to learn more and seed more of that kind of vision and strategy to others in the team.
Gloria, something to add to that?
From a programming perspective, I think I always empower the patients again that obesity is just a word. We're not going to give it power. It doesn't mean that you're a bad person, even though it made you feel really bad that now you see on your chart that you're obese. But really, what does that mean? It's just one number out of many that define your health. Let's look at your A1C. Let's look at your lipid panel. Let's look at, and so I think that not to dismiss it, right, but to validate that it did make them feel horrible, that their provider now said, you're obese level 2, or you're at risk for because you're in this category. And so from a programming perspective, it's honoring and validating, yeah, I'm sorry, it sucked that you got called obese, but it's just one number. Let's look at everything else, And so, yeah, I think this is going to be $1 million question. There is no right answer,
Yeah, we had 2 questions back to back. That actually it's just in the framing. So one of our attendees, again, thank you for sharing these. Said, can we start a conversation asking the child how they're doing at school or around friends, and so kind of starting a conversation around that. Affecting their well-being. The next person who asked the question said they're not sure that they'd feel comfortable talking to the kid about their weight. They'd rather talk to a parent first and say, hey, we have to have this conversation. Here's what's going on. And then basically discuss with them how to engage, with the child better. So obviously there's no one best practice. Everybody's different, but in y'all's experience, is there again, not a best practice. Is there a way to kind of negotiate both of those together? Jeannie?
So I can speak from sort of just a general pediatric perspective, but the number one, again, those of you who are familiar with Bright Futures, the number one thing is to elicit parent and patient concerns, right? That is like the underlying principle and where you should really start everything. And it can be eye-opening and it can inform so much, and it can be the springboard for a lot of the other things. And then you can use that to ask more. Well, this is interesting. Tell me more. Tell me more about, it's just literally a springboard for that. So asking about school, asking about what are your experiences, what are you concerned about, is a great segue to getting really important information that, again, is driven by the child or by the parent. To the point of parent and child, like that is a challenging one sometimes, particularly like all of you who work in pediatrics, like there's this dynamic at some point where you need to start talking to the child versus the parent. But so a lot of people, in terms of practices, people have employed having private conversations with a parent, or being able to have them complete a questionnaire or fill out something quickly to talk about that in a way that is not in front of the child, so that the provider can have that, and then also the provider can talk directly to the child. Often in absence, once you get to those teen years, you kick out the parent, right? So allowing for both perspectives to be heard. In my non-clinical experience, but my partnership with a number of clinical providers has been like, that's usually where you get the most information. Parents and kids themselves will tell you what they need, and it's just remarkable.
Anything to add, Jessica or Gloria?
100% agree with that. And I think as we've tried to look at like, how does that happen in practice? We've realized lots of things like, I mean, I have, as a PCP myself, I have endless compassion for the impossibility of how much we're supposed to do in any given visit, pediatric or otherwise. So, but then you also realize that like, hey, what can we ask in advance and just have in a form that can just be filled out? What can we change about our templates, about the order that people then feel compelled to ask these questions and click through the boxes, and really kind of blow up a lot of that we've just like, for the sake of efficiency or building out models, have ended up perpetuating the sequence of, you know, dialogue that we didn't mean to, right? And so I think, you know, yeah, it is about keeping things open-ended, looking at individual concerns, but also for sure that patient-centered care of individual measures of success with all of this, instead of just trying to get our, you know, admonition and that people, you know, people need to eat better and exercise more, and, you know, which is basically useless. But we still recommend counseling and BMI screening. So I'm sensitive to the factors outside of our control. But yeah, I think, you know, again, don't worry about getting it perfect, right? What is that? Perfect is the enemy of the good. Like, you know, there's just so many steps along the way, and each one can make its own little impact.
Great. We have exactly 5 minutes to now discuss family healthy weight programs. You know, each of you have talked a little bit about, you've mentioned programs, you've mentioned this. We have 4 questions in the queue on family healthy weights programs. So number 1 is on how can a health center partner with a program for patient referrals. Second one is around the specific interventions. What is a family healthy weight program? What are they comprised of? Third one is on qualifying for one, or does insurance cover it? Kind of how does that work? And then fourth one is on when do you refer a kid to a program like that? So we only have 5 minutes to cover that, but I'd love for us to just give a quick infomercial, I guess, about family healthy weight programs. Jeannie, what I'd love to actually turn to you first to talk about, like, what is an evidence-based family healthy weight program? And Gloria, I would love for you to talk about yours at your health center. And Jessica, you can fill in too. But if that works.
Sure, I will be quick, and I will drop resources. I realize we didn't put some of that in the end, so I'll drop some resources in the chat box too. But a family healthy weight program is it's a program that delivers intensive health, behavioral, lifestyle treatment, or intensive behavioral counseling. Both are evidence-based from the AAP recent clinical practice guideline and the U.S. Preventive Task Force recommendation. And the key components of it are it's longitudinal, and it has a level of intensity. So we're looking at 3 months to 12 months and at least 26 contact hours. And then the key components of that are health education, skill building, and behavioral counseling and goal setting are sort of the key elements that are appearing in all of those. And usually the other huge pieces, they're family-based, right? Gloria really mentioned that really well, like this notion they're family-centered, they're multidisciplinary, and they can occur in group or individual. They've been implemented in both ways, and they also can be virtual or in person. There's more evidence emerging around virtual options working, or a combination of both, so hybrid. And the CDC has recognized 6 family healthy weight programs, and I can drop that link in the site, and they are ones that have proven through evidence base that they are sticking to a curriculum and keeping these core components, and they have a package, for lack of a better word, that supports training and rollout of those components. So that's what's in those 6. And they are delivered sometimes in community centers, sometimes like community-based organizations, sometimes in clinic settings. Either or, they can happen in either place. That's a high level.
Tell us about yours. That's great. Perfect, Jeannie. Great.
We run a program out of both. So we do clinical setting and community setting. And so we have our Powerful Familias program, which is an 8 to 12 week family program. It's 2 hours, 2 times a week. We offer a cooking class and we offer a movement class, as well as some lectures for family and their kids to be adopt a healthier lifestyle, whatever that looks like to them. We base it off of the components of lifestyle medicine. We have a staff of about 3. I do all of the Spanish piece, and JL, who's the program coordinator here for Rio Health, she does all the English and the coordination for the program. We have nutrition appointments with our registered dietitian, who all are weight neutral. They all teach and see patients through a weight neutral lens, which is really nice because it complements our program. And then we also have our behavioral health team that steps up and does some of the sessions. And so we are on year 6 going into year 7. And it's a lot of work. It's a lot of work. But let me tell you, it is just so amazing to, again, empower families and teach them about health, and then you get to see them, spread their wings and eat fruits and vegetables, and let them know that it's okay to eat canned vegetables sometimes. Give them that power. So yeah, we're excited that we're a part of this, and we'll continue to be a part of this.
Wonderful. Any last words, Jessica? You get the last word today.
Oh, no pressure. I would just say that, you can start with these kind of packaged programs. CDC is funding like 56 recipients kind of across the country that have said that they're going to start implementing these programs. So we're hoping that more access is going to be out there. And a lot of those grant recipients are looking to partner with FQHC networks. So, you might be hearing more about this. I think what is magical about what Gloria and her team have done too, is they've taken those packaged interventions, and then their version of it that they're implementing now is adapted based on what their community is telling them that they need and want. And so, there's opportunities to engage in that work. And if we can help in any way moving forward, we're here.
Perfect. Thank you. I want to just thank our panelists so much, Jeannie, Jessica, and Gloria. You thought on your feet. You were prepped for some of it. You weren't prepped for others. So it's great. I think hopefully those of you who attended, you're getting lots of love and hand claps. I hope you all can see those. But thank you so much for sharing. And as Jessica said, we are here to talk more about it. So you'll get the slides and recording from this, but feel free to reach out to NAC. We're happy to kind of triage who could answer your question best, whether it is on family healthy weight, or having those conversations, or anything else. You will also be getting when you close out of Zoom, you'll be getting just a quick link for a survey. We would love to know how it went for you all, and also if you want to connect with us more, you can use that link as well. So without further ado, go about your morning or afternoon, whatever time it is for you. And again, thank you so much to Jeannie, Jessica, and Gloria for your time today, and all our behind the scenes staff that also put this together as well. Thank you.